Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The psychiatric mental health nurse practitioner is evaluating a patient in follow-up, and despite appropriate pharmacotherapy and psychotherapy, the patient has not achieved a successful remission. The patient states that his therapist is very nice, but that therapy is not really helping. The patient relates that the therapist keeps talking about, quote, phases of change, end quote, and steps like engagement, focusing, evoking, and planning. The psychiatric mental health nurse practitioner recognizes that the therapist is using which of the following? Lewin's change theory, motivational interviewing, interpersonal therapy, or cognitive behavioral therapy. So this is actually an evaluation question. The nurse practitioner is evaluating the patient's response, or in this case, suboptimal response to his current treatment modalities. In addition to being an evaluation question, you also have to have some understanding of the various types of therapeutic modalities, which is, of course, part of the requirement for being successful on your psychiatric mental health nurse practitioner exam. So this is a good opportunity to review them. And as it happens, B is the correct answer. While there may appear to be some overlap among certain types of theories, I mean, many of them are not mutually exclusive and may share some common themes. In this case, there are four very distinct steps identified here, and they are the steps of motivational interviewing. Engagement, focusing, evoking, and planning. They come right out of the motivational interviewing manual. And I'm not being facetious. For a therapist or any clinician to be good at motivational interviewing and to use it as a modality, they do need to be trained in it. I mean, it is a very precise therapeutic modality, and it requires training to do. And on a side note, motivational interviewing has been used not just in the world of mental health, but also in helping people cope with chronic illness. I remember a few years back as a faculty member, I had a student in an FNP program who was doing a project where she used motivational interviewing in helping patients cope with when they were newly placed on dialysis. So it's got a wide, or rather she wanted to use motivational interviewing, but when we started looking at it, that she didn't realize up until that point that it really does require some very precise training. It's not like you just decide, oh, I'm going to interview somebody and be motivational about it. Motivational interviewing is a distinct modality. It has several skills, and you do need to be trained in it appropriately to utilize it. And so what's really most important for this question is that you recognize that when the therapist is very distinctly using and identifying to the patient these phases of change, engagement, focus, evoke, and plan, that is motivational interviewing. And you might look at the word change and think, oh, is this Lewin's change theory? And it's not. Change theories like Lewin's change theory and the trans-theoretical model of change, the ultimate outcome is change, but the theory and the theoretical perspective is very different. Lewin's change theory is a theoretical construct that really centers around the concepts of unfreezing, implementing change, and refreezing. Unfreeze, change, and refreeze are the tenets of Lewin's change theory. And so Lewin's change theory talks about how when there's a state of equilibrium, forces promoting change are challenged by forces that are blocking change, and so nothing happens, right? When you're the same on either end, change does not occur. There's a steady state of equilibrium, and so according to Lewin's change theory, in order to effect a change, first you have to unfreeze the existing state of equilibrium. then implement the change. And then after the change occurs and the dynamic or the action is different, refreeze in the new changed state. So in other words, the new change needs the opportunity to produce its equilibrium, and then the patient remains in the newly changed state. Interpersonal therapy focuses really on relationships. I mean, the name kind of tells the story there, interpersonal therapy. It's a whole different type of modality, and it really focuses on relationships and evaluating relationships. And usually there's something very specific that the patient comes to therapy about, and that's analyzed, but it's about relationships with others. And then cognitive behavioral therapy, again, is a different modality. Cognitive behavioral therapy really centers around the patient, and there are multiple takeoffs on these. It's not like a very specific one thing. But the general concept with cognitive behavioral therapy is that the patient is thinking in a distorted and negative way, and that distorted negative thought process is producing symptoms that are interfering with their life. And so the real therapeutic approach is to identify those distorted thoughts, those negative distorted thoughts, and then reframing them in a positive way. So these are all therapeutic modalities, and they all actually may begin with the patient having something about themselves or their relationships that they want to change. But again, very specifically, motivational interviewing employs engagement, focusing, evoking, and planning. And motivational therapy, like I mentioned a moment ago, it derives from Rogers' humanistic theory, unconditional positive regard. With motivational interviewing, very foundational is that the patient needs to identify the change. The patient needs to look within. The therapist really doesn't identify things that the patient should change, or the therapist doesn't implement the change mechanism. It's really about helping the patient to explore within themselves their current state and if there's anything that they want to change. So you should definitely be familiar with these. I mean, not that you're expected to be able to implement any of them, because being a therapist is a different skill set that requires training. But you are, as a psychiatric mental health nurse practitioner, expected to know the basics of the various therapeutic modalities so that you can guide your patients appropriately.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.